Tim Chearman, Natalie Lau and Malcolm Newbury to present and facilitate the discussion. Allow it to hand over to Tim Chearman.
Thanks for people who have attended today and welcome to the webinar. We're looking at assets that might help the NHS in selecting and finding open source contextual information and open source products. This is part of a project around eHealthOpenSource.org, a community we're developing as part of a project with York University to help the NHS develop a community to develop open source capability and also enable them to leverage the best from open source products. So for this webinar, really, as part of our research, we found that there are some information tools which will really help the NHS in finding appropriate solutions. So two of these areas are around finding open source products, so how you actually find open source products for your requirements. The second area we'll cover today is around contributing to a project, and I think Malcolm might be having some input also around open standards. So we'll move to the next slide, and please, as we go along, for today, really encouraging people to click on the hand up button which is on the top of your screen, which you can then ask questions, and really want people to participate as much as possible. So in terms of finding open source products, really, and today we're focusing on thinking about the NHS requirements and reviewing some current offerings that are online at the moment, and really thinking again about what the NHS requirements might be, or if these products actually satisfy the NHS in terms of what they're looking for. And really the focus is on online information sources and not other mediums. So we're just focusing on the online aspect in conjunction with eHealthOpenSource.org today. So as part of the engagement we've been undertaking, we found that quite a few people are keen to evaluate open source solutions as part of the procurement process, but are not quite sure how to start or where to start. So I'd like to ask people to comment and put their hands up and say if they've found this either difficult or easy, and share some local learnings. So in case of around these two questions, so how would you actually find the appropriate products from an open source perspective? Is this something that people are aware of in your trust, or would you actively go out and search for those, or would they come in via suppliers? So if anyone has any first-hand experience around this, please put your hand up now. Really, looking at this, there's quite a number of different ways in thinking around how to access open source. So one aspect is you could actually look at the open source offerings from a point of view of business function, or you could approach it from technology, or you could be very much focused on open standards and making sure that the available technology fits certain standards that you're looking to implement strategically in your organisation. But that really gives you a thought, well, where would I actually look and how would I actually find these products? And looking at current online directories, there is a eHealthOpenSource.org site which we've created, which gives some links out to products. There's a Wikipedia directory of well, not NHS, but healthcare open source products, which is not too bad, but it's quite generic. There's also a very interesting news site, which is all these are sort of open and shareable sources. There's also a new directory called MedFloss, which I thought was quite interesting. I might actually just pull that up in a second. So we've got a list of open source healthcare software from the wiki, and MedFloss, which I'm actually going to open now. Let me just try and share my screen. Okay, so you should be able to see now in the main view. I'll just take that out. You should be able to see my screen and the MedFloss site, which is the medical free Libra and open source software directory. And the interesting thing here is looking at what we might require for the NHS, you think, well, actually quite a lot of it is probably here. Let me just take that out. So we've got let me scroll down. We've got products actually categorized by popularity, application type, enterprise function, license, and by standard, which looks to be a really useful cataloging. We've also, if we go into the actual product itself, there is a directory which gives a star rating. I'm not sure how useful that might necessarily be. The application type, so the good thing is classified by clinical, EMR, hospital management, medication management, and so forth, or enterprise function. Also, importantly, which is going to come into later, the license is catalogued. And we have the languages that the software's in, any standards that it's compliant with. In this case, it's the NIST standard, which I'm not actually conversant with, and also client type and platform. So I thought this was actually a really useful site for people looking to understand what's actually out there from a healthcare point of view in the open source environment. Now, hopefully, people are going to be able to put their hands up and comment on this and think about it, because what we're really looking for is to understand what's actually relevant from the NHS perspective, because there might be other information or context that people might be looking for just from point of view of the NHS. I'm just going to go back into the PowerPoint. So if people would like to put their hands up now, hopefully we can get this working. So if you click the bottom at the top of your screen with the hands up icon, and then Barrett will put through your questions and comments, because we'd like to encourage collaboration as far as possible. So again, I've sort of listed the possible attributes that we've got on the Metafloss solution. I was going to hopefully get people's input, and I know people are keen to give input if we can get the technology working for us around the different assets of applications or offerings that would be useful to have catalogued from an NHS point of view, because there will be probably different considerations in terms of level of information governance and security and so forth that will be useful to have. Just commenting around if we're talking about open source alternatives to other aspects of the technical environment. Great, and Malcolm, and we've got a whole raft of stuff here, which is great. From Malcolm, we've got a comment on OLO. I think I'll have to have a look at that. It didn't come up. I didn't find it with my searches, so really keen to have a look at OLO. So Rob, you're talking about MySQL, Postgres. So you're talking about more generic technology, I guess, and rather than from a clinical point of view. Yeah. So, and I think, yeah, I think it's worth mentioning that there are obviously some very generic open source tools out there that can be applied to healthcare, and then there are a category which is the type of applications which are focused on healthcare in their core requirements and scope. So I don't, from eHealthOpenSource point of view, we like to sort of link out to any relevant software that can be used, but we were focusing in this case of software that's applicable to healthcare from a clinical perspective and the categorization of those systems.
Hi, it's John here. Can you hear me now?
Hi, John. Yes.
In general, the procurement process for particularly sort of reasonably sizable government procurements is governed by the OJU process, and that is such an elaborate and expensive process just to go through that it very much makes it difficult for any vendor whose product is not actually significantly expensive. It makes the upfront costs of just bidding very expensive. And at the Healthcare 2011 thing, a guy called Ben Gregory, who's my boss actually at work now, gave an interesting set of notes about how difficult the process can be and ways of getting around it. And I do think that that's probably one of the things that makes it really hard to get open source. You know, even if the products were excellent, I'm not saying they're not, but even if it was a no-brainer from the product point of view, just somehow getting through that process seems to be difficult if it's not an expensive product at the end of the day, because it means the upfront costs of sales are very high.
Yeah, Yeah, that's a really good point actually, because from an open source perspective, it takes a supplier to go at risk to propose a solution and actually work out how, if they are going to foot the cost for the procurement process, or if the trust is going to do that, and that's a difficult question. I think it's worth one we can just note down for now and think about how that relates to the bigger government initiatives recently discussed and released around preparing the market for open source. But if there's barriers like that in place, it's going to be one of the ones that needs to be worked out, isn't it? It's a really good point. Thanks.
I'm sure I could get hold of Ben's notes from that if that would be useful for the group.
That would be helpful. That'd be really helpful. Yeah. Maybe.
Adrian Byrne from Southampton University Hospital. The procurement costs are certainly a significant aspect of this, but then again, you could say that any other supplier is bound with the same kind of constraints if they're going to bid for anything with their own products. And someone coming in with open source is clearly making money aiming to make money from project management, configuration, implementation, all that kind of thing. My question was around how you would think that this squares up against things like the FDA approval in the States, or the ISN's 2009, 14 or 18 in this country.
Is that relating to the safety aspect?
Yes.
I think it's. To be honest, I'm not sure. I think the safety system and the safety recruitment of local safety managers in the trust means that the safety will be managed at a trust organisational level. So as with any software solution, the part of the testing and evaluation will be from a safety perspective. So I'd expect that to be the same for the open source solutions as with any other solution. Is there any particular aspect related to open source you were wondering?
Well, yeah, because by definition there's less control over the code, and therefore I would question an individual organisation's ability to assess the level of safety to the same level of assurance that you could with someone who is very controlled in terms of number of releases per annum that go through a rigorous testing program, etc.
Yeah. Okay. That's a good point, and I think it's one which is a sort of question to open source suppliers as to how they would manage that. And I think it also relates
to a company about 18 months ago called Tolvan in the US. Heard any of them? Heard of them?
I think so. Someone on the call I know works closely with Tolvan. Yes, so I've definitely heard of it. Very well used piece of software.
There are mechanisms for getting the approval, but you end up with a fair amount of infrastructure around to get that, and of course that starts to erode some of the business case for going open source in the first place. So it's just worth bearing in mind that you're actually setting up, around this. By the time you set up the bureaucracy, that you then, have a significant chunk out of your benefits.
That's a really good point. Is that I think it's one of the things we need. Even making people aware of these aspects of the bidding and safety assessment as part of the any open source evaluation as well is really useful. I see we've got some comments on your comments area around the bidding costs being loaded into the licensing costs for current suppliers. So that's a way of covering it. So I think it's Rob Dyke. I don't know if you're available on the speaker.